Hello there and welcome back. Living with an anxiety disorder is not easy for anyone, but imagine being a news presenter and having a panic attack in front of 5 million people. Well, that's what happened to Dan Harris when he was live on air. He's called it the most embarrassing day of his life. And this is what happened to Dan. Let's take a look.
We're going to go now to Dan Harris, who's at the news desk. Dan.
Good morning, Charlie and Diane. Thank you. Wall Street honors former President Reagan this morning. Health news now. One of the world's most commonly prescribed medications may be providing a big bonus. Researchers report people who take cholesterol-lowering drugs called statins for at least 5 years may also lower their risk for cancer. But it's too early to prescribe statins slowly for cancer production.
That's Dan Harris. So we're hoping to speak to Dan in a moment, but joining me here in the studio is Dr. Cinzia Pezzolesi. I hope I've pronounced that correctly. My fine Italian, perhaps? Yeah. Let's talk about the anxiety, because we saw there in Dan's clip the breathlessness, the getting even more anxious by the second and losing the ability to speak. Just give it, in medical terms, tell us exactly what you think was going on there.
What was going on was a panic attack. And so you have the feeling, you have a lot of physical sensations going through your body. So short of breath, you feel your heartbeat going very fast. You also feel like you're breathless. So it's very hard to pronounce and to speak. That's why in that particular situation must have been very hard. But on top of that, you have a lot of thoughts and emotion going on at the same time. So you might think that you're about to have an heart attack, or that you're about to go mad, or feeling out of control.
Okay, well, let's find out about those thoughts and emotions, because the man behind that moment, Dan Harris, joins us now live from Boston. Dan, tell us, what were you thinking at that moment?
I was thinking my career was about to end and that I needed to get it together, but then the more I was trying to get it together, the more I was falling apart. And ultimately, I just had to quit. As you saw in the clip, I had to quit right in the middle, which is something I had never done before.
A news anchor's worst nightmare. I mean,
Correct.
Did you suffer from panic attacks before? Was this the first time this had happened to you? Or, I mean, did you report this before, that you're thinking, you know, I'm in this situation and this could happen perhaps in my professional sphere?
I had low-level stage fright in my entire career, which, as I write in my book, made my work life a triumph of narcissism over fear. However, I had never had a panic attack of this magnitude, and definitely not in front of 5 million people. So this was a first. What
did your colleagues do around you? I mean, the floor managers, the studio, what do they do? Do they think, oh no, he's dying a very slow death here on air? Or did anyone come to your rescue?
Yeah, afterwards everybody ran over and said, what happened? Are you okay? And I didn't have the guts really to tell the truth. I said, I don't know what happened. I kind of brushed it off. And you know how the news business is. Everybody sort of lurches on to the next crisis. And an hour later, I was able to get through another newscast just fine. So I kind of, for lack of a better term, got away with it, although I knew exactly what had happened.
And tell us how you deal with that level of anxiety. I mean, you've obviously had to find some tools to cope with it. Well, I mean, how did you do that?
Well, there's a bit of a yarn here, and I'll try to keep it short, but I ultimately went to see a doctor and who was an expert in panic, and the doctor asked me a series of questions, one of which was, do you do drugs? And sheepishly I said, yes, I do. And he said, he kind of gave me a look that said, all right, idiot, mystery solved. And he pointed out that drugs can raise the level of adrenaline in your brain. Let me just give you just a little bit of a backstory. I had spent many years before that clip, this is in the early 2000s, covering war zones in Iraq and Afghanistan, the Middle East. When I came home, I got depressed, and I self-medicated with recreational drugs, including cocaine and ecstasy. And the doctor explained that even though I was only doing it sporadically and for a brief period of time, it raised the level of adrenaline in my brain and primed me to have this panic attack. And I knew in that moment that I needed to make some changes. Sure,
okay, but just very briefly, if you will, Dan, I mean, what have you learned to do to control that level of anxiety and the panic attacks that might ensue?
It was a long a long, strange journey, but ultimately I came to meditation, which I always thought was only for weirdos and hippies and people who wear robes or live in a yurt and listen to a lot of Cat Stevens records, et cetera, et cetera. But as it turns out, there's an enormous amount of science that says it can lower your blood pressure, boost your immune system, and literally rewire key parts of your brain that regulate well-being and stress. And so now I've become sort of an unlikely evangelist.
Well, do you know what, Dan? I don't think I'm a weirdo, and I do a bit of meditation. But what are the medical benefits surrounding meditation? I mean, are there any?
Of course there are. Meditation is, especially mindfulness meditation, that's what I use with my patients, is evidence-based. And it's been used to cure depression relapses, to treat people from addictions, for instance. And it's been proved, research has shown that, for instance, in addiction is 3 times more effective than any other treatment. So cognitive behavioral treatments or psychoeducation that are commonly used methods. Is also used for a range of disorders in which people struggle to regulate impulses, such as eating disorders, for instance. So the evidence base is there.
There's another word I wanted to ask you about, and that is a bit of a buzzword now called mindfulness, and how being mindful will help you to calm your mind and tackle, like you said, addictions or perhaps panic attacks in Dan's case. But again, I mean, in the medical world, is the concept of mindfulness embraced, and is it being perhaps thought of as a successful way to treat mental health for people?
Is indeed very successful. I have to admit, there is resistance. So what Dan said, there was a bit of resistance on his side to embrace the concept, but you see the benefit afterwards. Mindfulness can be considered a sort of behavioral medicine. So it puts together the links within what happens to you in the body and in the mind, and the effect that the mind has got in the body.
And Dan, did you go back to the office and say, you know, you're going to carry out this meditation process, it's going to be part of your daily life as a news anchor? I mean, how did people approach you and think about that? Were you kind of isolated slightly in that?
Initially, there was a lot of skepticism. People would say, what happened to you? Why are you doing this? It's sort of the parenthetical, unstated was, have you joined some sort of cult or something? However, after a while, I developed a little bit of a response, which was when people would ask me, why did you start meditating? I started to say, because it makes me 10% happier, which is obviously a joke and an absurd estimate, but I found that people started, in my very skeptical business, started to respond. I could see the looks on people's faces transforming from scorn to something approaching interest and maybe even envy. And that's what I think the promise of mindfulness and meditation really is. It's not going to solve all of your problems. There's an enormous amount of research that suggests it can help you with an almost laughably long list of conditions, both physical and psychological. But it is something we should add to our list of things we do, our list of no-brainers, alongside of brushing your teeth, exercising, eating well, the list of things that we do and that if we don't do, we feel guilty about.
Do you still suffer from panic attacks?
Since I stopped using drugs, I have not had a panic attack. However, I don't think it's a curable condition, at least from what I can tell in my research and in my treatment. Once your brain learns how to panic, it gets very good at that. So I have to structure my life around trying to remove all of the conditions that would give me a panic attack. So stopping doing drugs was the big one.
Yeah, sure. Well, let's ask the expert. Can you, once you've had a panic attack, are you stuck with it for life?
In a way, that's true. That when you experience anxiety, it's more likely that you're going to experience it in the future, and there are events that might trigger the anxiety. What you learn with mindfulness is how to befriend your anxiety, so become intimate with it, so it doesn't scare you anymore.
It's been fascinating to speak to you both. Dr. Cinzia Pezzolesi, thank you very much for that. And Dan, thank you. I'm glad it was you and not me. Thanks very much for that, Dan Harris.
Likewise. I don't wish it on anybody. Thanks for having me on.